Male, 34, just got out of the Marines after 2 years in Iraq. Admitted complaining of chronic fatigue, joint pains, intermittent rashes, and sore throats. Thinks he has Gulf War syndrome.
Why is he here instead of the VA?
He has a rich uncle Cuddy is trying to avoid filleting, who doesn't buy the VA's diagnosis of nothing's wrongatosis.
The VA's right. There's no such thing as Gulf War syndrome, especially in veterans who've never served in the Gulf War.
Different war, same place. Whatever was there in 1990 is still there.
What's there can send you home in a pine box, but it can't get you sick 3 months after you've gotten home.
What, so thousands of soldiers are lying about the symptoms?
You send 700,000 people on vacation to Hawaii. Some are gonna come back sick. Doesn't mean it was caused by snorkeling.
He's right. Studies all show the same pattern of symptoms in veterans who were sent to the Gulf and those who weren't.
That's it? You believe her, but not me?
Just stick to your guns, Chase. Just because there isn't a single unifying symptom doesn't mean there isn't something going on. It could just affect everyone differently.
You think this guy has Gulf War syndrome?
Of course not. He's depressed and he's looking for a disability check. Most likely because he's just realized that knowing how to barter for sex in 6 languages and open a beer bottle with your eye socket are not the most marketable skills.
Why'd you take this case?
Because a good scientist continually questions his own theories and assumptions.
Cuddy's making him.
And now I'm making you. Do a full physical and recheck his blood for HIV, Hep C, malaria, schistosomiasis, and T strain A Bumani, just to make sure the VA's dotted their I's. And find out every hospital and clinic he's ever visited, every city he's ever lived in, and whether he's ever been on TV.
TV?
Problem could be neurological. Everyone knows TV rots your brain.
Well, it's usually the worst on my palms and the bottoms of my feet. I get these black dots all over them.
I don't see anything.
It comes and goes.
You sure it's not just scrapes and bruises?
I know the difference between a rash and a bruise.
Sometimes it's harder than you realize to distinguish between the two. You obviously exercise.
My problems aren't caused by my workouts.
But you do work out. And by the look of you, pretty strenuously. That's not usually the case with patients whose principal complaint is chronic fatigue and joint pain.
I was in the Marines for 12 years. I'm used to doing PT every day. Just because I can push through the pain doesn't mean it's not there.
We're not saying we don't believe you.
The hell you aren't.
We just need to be specific about what exactly the problems are.
I sleep 10 hours a night, but I feel tired all the time. I constantly get coughs, rashes, sore throats. My knees and hips feel like someone poured sand in my joints. I get these weird tingling sensations in my legs. Sometimes they're cold. Other times, it feels like my blood is boiling. Specific enough? Look, I don't care what you guys call it. Gulf War syndrome, Iraq fever, or just crappy sickness X. I just want someone to figure out what it is so they can cure it.
Except for the supposed pain in his joints, none of the other symptoms he's complaining about are currently evident.
Besides low potassium, probably caused by him overhydrating after working out. His blood work's all normal.
Low potassium could also probably be caused by the experimental vaccines and anti-chemical warfare pills he was given before he deployed to Iraq. Not to mention the fact that whole country's littered with hundreds of tons of radioactive shrapnel from depleted uranium munitions.
You go to medical school in France, there's no trace of uranium in his urine. He was given the vaccines and meds 2 years ago without any allergic or adverse reaction.
Has he ever done any modeling?
We forgot to ask. We should send his urine to the University of Leicester. There's a professor there who's developed a more advanced screening technique for uranium.
The levels are too low for us to detect. They're way too low to cause any damage. Where are you going?
This way. Did you find out about any television or other media exposure?
Do you really care, or are you just trying to waste hospital resources to get back at Cuddy for making you take the case?
Of course I care. What a horrible thing to say. Do a LexisNexis search, get a copy of his credit report.
Before or after we tell him to eat a banana and discharge him with a psych referral?
I say before. And I say in between, give him a polysomnogram. Sleep apnea could cause chronic fatigue and paranoia. Find out where he went to summer camp.
You okay?
Yeah, just a little too much coffee this morning.
Were we walking you to the bathroom?
I wish. Wilson was just in there. These guys know what I'm talking about.
That's his 3rd REM cycle, and his breathing is completely normal. There's obviously nothing wrong with his sleep pattern.
It's not the uranium. It's got to be some other sort of toxin.
Or nothing at all. You really think there's something wrong, or you just want Foreman to be wrong?
Both.
Well, it's not his sleep pattern. If you really think it's a toxin, you can do a liver biopsy in the morning.
We can't leave. If we don't monitor the whole test, House won't accept the results. They'll just make us do it over.
It doesn't take 2 doctors to monitor what's clearly going to be a normal polysonogram.
Oh, so you want me to stay?
You're the one who thought there was something wrong.
I never said it was a sleep disorder.
You want to flip for it?
Just go.
Oh, come on. Don't be a baby. Fine. I'll stay. You know what we could do?
Here?
Why not? We're surrounded by empty rooms with beds in them.
Yeah, and video cameras too.
So we turn them off.
Yeah, that's all I need is House or foreman walking in on us.
We have the keys.
No. What if he wakes up?
All right. Suit yourself.
Hello? Is anybody out there? I think there's a problem in here.
What's wrong?
What do you mean, what's wrong? You don't smell that?
Nothing smells, John.
Are you kidding me? It's disgusting.
How long have you thought... Wait. Open your mouth. The smell's not in the room. It's in your mouth.
What's going on?
Good question.
Antibiotics should at least relieve the infection, which will reduce the odor and taste in your mouth.
Not soon enough.
All right. You're gonna feel a little burn.
You never even dipped? Chewing tobacco. Practically everyone in my unit did. But me, I was so paranoid about cancer.
Well, if it's parotid cancer, it's very treatable if diagnosed early.
My mom had cancer, which is why I know that diagnosing cancer early means before there's any serious symptoms. Certainly tastes like a pretty serious symptom, you know?
We'll know more after the test.
He was just trying to mess with Cuddy for wasting his time. This would have stopped as soon as the patient started exhibiting actual symptoms.
So the question is, why is he wasting our time?
Or is he wasting our time?
You think he's got a medical reason for asking for the guy's credit report?
I don't. Where were you two when the guy woke up?
We just stepped out for a second.
To do what?
To get a coffee. We'd been up most of the night.
Just pushing to make sure we have a complete history. Obviously, we're missing something or we'd have the answer.
You didn't have any coffee when you came back.
All right, already. We confess. You caught us. We snuck into one of the sleep lab rooms to have sex. We shouldn't have done it while we were supposed to be working, and we're sorry. Now, can we move on?
House would do Wilson before you do Chase.
No. You would do House and Wilson before I do Chase. Now, can we get back to work?
She did me once.
She was stoned.
Okay, this time you're gonna feel a little pressure. We're injecting the contrast material.
Hey, could you turn up the music?
Sure. Looks pretty good so far.
Still can't hear it that well.
Can you hear it now? John? John! John, can you hear me? Still no relief?
I got relief. Just got no pee.
If the pills didn't work, you may need a catheter.
You didn't come here to talk to me about my pee. What's going on?
He's got cancer, all right. But it's not in his salivary glands. It's in his brain. And it's bad. At least 6 tumors, maybe more. He lost his hearing. His sight's probably next.
Death is probably next. 38-year-old former Marine came into the ER with back pain. Now his bladder aches as much as his back because he can't empty it. What are we looking at this morning? Upskirt celebrity, endearingly funny cat.
Another study about gays being better parents who were lured in by the word lesbian. Has he taken any antihistamines or anticholinergics?
Nope. In the ER, ruled out enlarged prostate, stuffed colon, and spinal injury.
Military history. In suspiciously good shape for his age. Makes a living bullying kids. I'm thinking steroids?
Fascinating.
Thanks. We can wean him off.
Steroids isn't fascinating. It's moronic. There's no other sign of hormonal imbalance. What's fascinating is that you equate discipline with bullying, which means that your parents either discipline you too much or too little. I'm guessing too little.
It's hardly surprising you agree with our patient's philosophy. You run your department like a boot camp, as if cruelty ensures performance.
Oh, is this where I'm supposed to disagree with you?
Diagnosis of urinary retention depends on the particular mechanical cause. We need to know if there's a blockage in the urethra versus a nerve or a muscle problem with the bladder.
Fascinating. Without misdirect. Cath him and see what's stopping him from emptying his bilge. Oh, not you, Chase. Sending Captain Micropenis to deal with what's probably normal-sized equipment. It's too cruel even for me.
You feel pressure. We need you to tell us when the urge to void becomes unbearable. Sorry, can't make you feel better till we make you feel worse.
I get it. Goes for what I do, too.
We cause pain when it's the only option.
You know, the kids I work with at the camp are there because a judge sent them. I can't teach them good behaviors without first getting rid of all their bad ones. That's not gonna happen unless I push them.
I don't see why metaphorical pushing has to involve actual pushing.
I may work these kids hard, but I never hit them.
You march them into the ground instead of knocking them there.
Yeah, well, it beats the alternatives. Just ending up in jail or in a gang, or a coffin.
How often you pull that off?
2/3 never reoffend. That's better numbers than juvie.
She's brilliant, but new to the real world.
Yeah. Hey, Doc, I gotta go.
Let's empty you out. You'll take the urine to Taub, have him screen it for bacteria. I'll analyze its data.
Urine is clean for bacteria.
Not surprising, since his bladder test showed that his peeing problem is really a nerve problem, neurogenic bladder.
Could mean spinal cord tumor, cerebral palsy.
House is gonna go right for syphilis.
How can you be so sure?
Rare complication of an embarrassing illness, practically a house special.
Want to get ahead. Let's go test his blood for syphilis.
Okay, I'm gonna take some blood. This will only hurt for a second. Ready?
Stop it! Stop trying to kill me.
Hey, let her go!
Let go of trying to kill me! Let her go!
Security! Need some help in here!
Let me go! Let me go!
She's fine. How about we get back to someone who isn't?
The patient's in restraints and on Haldol, which seems to have made him lucid.
Differential diagnosis. Back pain, neurogenic bladder, psychosis.
Symptom which we learned about when he choked me. Hate to slow us down by acknowledging it.
And yet you have. Tertiary syphilis fits.
Test came back negative. Several meds could cause those symptoms. Tricyclic antidepressants, Ritalin.
Also other native plants. Wormwood, Jimson weed.
The amount of Jimson weed or Ritalin he'd have to ingest seems like he would have mentioned it.
Unless he didn't know about it. Maybe one of those kids at the camp got tired of Driscoll's lessons and poisoned him.
Go to the camp, check for potential poisons.
These IV fluids will help flush the drugs out of your system.
You know which of the kids dosed me?
It's not medically relevant.
Look, I'm not gonna hurt him. But I get why you're scared of me. I'm real sorry about this morning.
No apology necessary. You're ill. You didn't know what you were doing.
Yeah, I used to be a real screw-up. Military taught me that actions always have consequences. Part of being a man is accepting them. After all the times I said that to the kids, apology is necessary.
Are you okay?
Oh, my heart's kind of racing.
I got it. Heart rate is 170. PAT. Until proven otherwise, we've got to slow it down. 6 milligrams of adenosine, IV bolus. Tell the nurse to get in here with a crash cart.
We checked his adrenal, pituitary, and thyroid glands. Monitored his catecholamines. It's not a FEO.
We had to put him on a diltiazem drip to regulate his heart.
Means he's running out of time. Means you are, too. Your campaign to soften him up so he'll go easier on the kids. All in a pointless attempt to validate your own upbringing. Another cardiac arrhythmia?
Not our patient. It's the ER.
That patient house admitted with back pain and urinary retention? How do you feel about a match set?
We need to track your common exposures. What shampoo do you use?
Whatever crap the camp gives us.
Same here.
We need things exclusive to you, but not the rest of the camp. Otherwise, a lot more people would be sick. Toothpaste, deodorant.
Can't be deodorant making him sick. He doesn't wear any. He smells like a
Clark, shut your mouth.
Hey, you're not my drill instructor in here, okay?
Doesn't mean you get to be disrespectful.
Look, I can do whatever the hell I want. You're not in charge.
Stop him!
Hey, where you going? Hey, you're sick. You need to be in the hospital. There's a million hospitals. Someone won't send me back to that camp.
Landon, what's going on?
Please, help me. Don't send me back.
Those are my car keys. You stole them out of my pocket?
No bad kids, huh?
Did you stop, Landon?
Yeah, what's wrong?
My legs, they hurt. Muscles are in a vice.
What does it mean?
I'm not sure yet. 10 diazepam, 40 potassium.
I saw my chance to get out of here. I had to take it.
Don't make excuses. You tried to steal from me.
Oh, these kids are manipulators. You can't let your guard down.
What do you mean, all these kids? Don't let me in with the losers at that camp.
Seems like you belong there. Maybe your only chance.
Look, I've screwed up, but I've never been in trouble with the law.
You said you were in for shoplifting.
Store owner caught me trying to boost some chips and stuff. Called my DCS caseworker.
I thought all the kids were there under court order.
That's usually how it works.
So, why is he different? I just got off the phone with Landon's DCS caseworker. You were right. I'm not what made my argument compelling.
Where are we going?
To give your bladder an antibiotic wash to protect against infection.
Who are you?
I'm Dr. House. And that boy is the spitting image of his mother. Of course, I've never seen her, but his care worker told my lackey that you paid his enrollment fee at the camp. It could mean that you're a family friend, but then why hide it? The only person who want to hide it is his deadbeat dad, who's decided not to be a deadbeat anymore.
Please, don't tell him.
We spend days looking for a link between them. He doesn't tell us the kid is his son.
We were looking for exposures. He didn't think it was medically relevant.
Soon he won't have to worry about his kid finding out. Being dead makes keeping secrets much easier. Neither one was responding to botulism treatment, and the boy started having seizures.
And Driscoll might have been right that their biological relationship doesn't matter. Genetic illness emerges when people are the same age, not during the same week.
Unless there's a trigger. Genetic conditions can be set off by things in the surroundings, and these two obviously share surroundings.
That's a relatively rare phenomenon, which is our specialty.
Our
I know.
patients are related. That can't be a coincidence. I just had an idea.
Relevant to our case?
No.
Sit. Wagner's can be brought on by exposure to heavy metals. You see anything at the camp?
Near the isolation hut, there were some old generator batteries. Could have leaked into the soil.
Seems like someone else at the camp would have had lead poisoning.
You got anything better? Treat with cyclophosphamide.
Latest kidney function test shows no improvement.
Nice stitches. Do they hurt?
No, they gave me a shot or something.
That was lidocaine. Triggered an underlying genetic condition called variegate porphyria.
Well, that would explain their symptoms.
But I didn't have any lidocaine.
You had a handful of antihistamines courtesy of the deviant in the next bed. It's also a porphyria trigger.
Wait, so we have the same genetic thing?
Yeah. Small world.
Well, this is good news. We can manage the condition with hematin. Liver transplant could cure it.
Sometimes two patients share one donated liver. Would that work for us?
Possibly. We'd have to test your blood, tissue type, if they matched.
Why would they? Just because we got the same thing making us sick.
Also, I'm your father.
CBC was unremarkable. Abdominal CT scan didn't show anything. So, people, differential diagnosis. What's wrong with her?
Him.
Him, her. Does it matter? Does anyone think it's a testicular problem? No. So, Chase?
Yersinia infection?
No, you wouldn't get the rash or cough. What about arthritis? Accompanying vasculitis causes nerve damage.
No, it wouldn't cause the blood pressure problems. Allergy?
The kid's got abdominal pain. Maybe carcinoid?
No, but then you wouldn't get the...
Foreman, if you're going to list all the things it's not, it might be quicker to do it alphabetically. Let's see now. Absidia. Excellent. It doesn't account for any of the symptoms.
No condition accounts for all these symptoms.
Oh, good. Because I thought maybe he was sick. But apparently he's not. Who wants to do up the discharge papers? Okay. Unless we control the blood pressure, he's going to start circling the drain before we can figure out what's wrong with him. Treat him for sepsis, broad-spectrum antibiotics, and I want a cord stim test and an echocardiogram.
You all right?
Cord stim test will tell us if your pituitary and adrenal glands are working properly.
With glands, what does that mean?
We have a few theories we're working on.
You mean you don't know?
Mindy.
I'm just saying if they knew, they wouldn't be testing you, they'd be treating you.
Yeah, well, that's the way it works. First you find out what it is, then we get you better.
Before this happened, we were having sex.
What, you're wondering if whatever he has, you might have gotten it? It's unlikely, and we ran a complete STD panel, so...
No, I'm wondering if maybe I did this to him. I was kind of rough.
She thinks she rode him to death.
What'd you tell her?
I told her 22-year-old men don't die of sex.
What'd you ask her?
What do you mean?
I mean, I hope you got some specifics on exactly what was going on. It's a girl with things that could kill you. It's worth knowing about.
Have you ever taken a life?
We should stop the antibiotics.
It's too soon to say they're not having an effect.
They're having an effect. His BP's falling fast. There's fluid filling his lungs. His creatinine is rising. His kidneys are shutting down. Our treatment isn't making him better. It's killing him.
Cardiac infection. Cameron, you thought allergy? Chase, what was it? You thought carcinoid? And then there's hypothyroidism. Could be parasites. Finally, sinus infection.
If you're gonna list all the things it can't be, you're gonna need more colors.
Cameron was right. No condition explains all these symptoms. Orange and green covers everything.
Orange and green? Two conditions contracted simultaneously?
Occam's razor. The simplest explanation is always the best.
And you think one is simpler than two.
Pretty sure it is, yeah.
Baby shows up. Chase tells you that two people exchanged fluids to create this being. I tell you that one stork dropped the little tyke off in a diaper. You're gonna go with the two or the one?
I think your argument is specious.
I think your tie is ugly. Why is one simpler than two? It's lower, lonelier. Is it simpler? Each one of these conditions is about 1,000 to 1 shot. That means that any two of them happening at the same time is 1,000,000 to 1 shot. Chase says the cardiac infection is a 10,000,000 to 1 shot, which makes my idea 10 times better than yours. Get a calculator, run the numbers.
We'll run the tests.
Tests take time, treatment's quicker. Start the kid on Unison for the sinus infection and... What was orange? What'd you find out?
Kidney failure. It's acute interstitial nephritis.
I wonder if that's significant.
It means the antibiotics didn't cause the kidney failure. How'd you know?
Well, if you guys hadn't been so busy trying to prove me wrong, you might have checked in on the poor kid.
You visited a patient?
I was sitting by his bed all morning, just so he'd know someone was there for him.
I looked in on him. He's much better.
Ergo, the treatment's working. Ergo, me right, you wrong.
Hey, I'm glad for the kid.
That smugness of yours really is an attractive quality.
Thank you. It was either that or get my hair highlighted. Smugness is easier to maintain. White cell count isn't up, is it?
No. We were both wrong. White cell count is down, way down and dropping. His immune system is shot. We need to get him into a clean room. Something's made him immunocompromised.
His white blood cell count is down, which means his body can't fight off infections.
If he gets sick, he'll die.
Sick? How sick?
If he gets a cold, he'll die.
He's resting.
I'm Dr. House. I'm your son's physician.
Oh, you're the one we haven't met yet.
You're the one he hasn't met. How can you treat someone without meeting him?
It's easy if you don't give a crap about him. That's a good thing. If emotions made you act rationally, well, they wouldn't be called emotions, right? That's why we have this nice division of labor. You hold his hand, I get him better. If I start tucking him in at night, well, that's not fair to you guys. And if you start prescribing medicine, well, that's not fair to me. So what I want to know is, who stepped on my side of the net? Who cared enough to get stupid enough to give him his cough medicine?
When we checked in, Dr. Foreman told us
Tuesday, he's getting better. Wednesday, he's getting sick again. Somebody gave him his cough medicine Wednesday. Come on, nobody's gonna be mad. I just want to know who tried to kill the kid.
Dr. House, maybe we should
His
reach
throat was sore.
Page Dr. Occam. He's gonna want to hear about this.
Sorry. He was coughing, and I just wanted to help him.
Aren't you a dear? Where are the pills?
He took the last of them before he was switched into that room.
They're all gone?
It was just cough medicine.
No, it wasn't. Where's the bottle?
We need to know exactly what you put in this bottle. We think it was colchicine, a gout medication.
If the prescription said cough medicine, that's what I dispensed.
The family is prepared to waive liability, all right? We just need to know what it was, what dosage it was.
It was cough medicine.
Refill it.
Hi again.
Where's he going?
Hey, how you all doing? Interesting fact, every 7 years, it's a whole new you. Inspiring metaphor, huh?
Dr. House, this is a clean room.
Yeah, I read the sign. But cells of different organs reproduce at different rates. So, you get a new kidney every 3 years, you get a new stomach lining every week. This is why colchicine poisoning causes all these symptoms, but not all at once.
So we went to the pharmacy. We saw the pills.
Colchicine does its damage in a very specific order. First of all, There's the pain in the abdomen, the rash, the fever. Isn't that what you got first? Then the kidneys go, which is exactly what happened to...
Brandon.
Right. And it screws up your bone marrow, and then neuropathy. Painful tingling in the fingers and toes. And what do you suppose happens after that? Hair loss. The bad news is, your special boy is doing drugs.
No, he's not.
Ecstasy?
No.
Toys with Dan and Mike.
You know what they cut that stuff with? Apparently colchicine. Unless you ingested the colchicine through your contact lens solution or skin cream or some other drug you're lying about. I don't know how it happened. I don't care how it happened. It happened. Start,
Brandon.
Lovely, Amy. Start Brandon on fab fragments and get him some Tylenol for the hair I pulled out. And get some air in here. Make a note. I should never doubt myself.
I think you'll remember. You know, it wouldn't hurt you to be wrong every now and then.
What, you don't care about these people?
Thanks, Jimmy. All right, let's see how many more turkeys we can miss. Yeah, this'll work.
What the hell? God, sorry, I don't know what happened. I can't move my arm. Am I having a stroke?
I don't know.
The self-important jerk does not have transverse myelitis. He's got cancer.
How do you even...
Okay. Maybe I paid the redhead down in records a few bucks to CC me on all your cases. A few patients die, you might get sad again. Make a speech that would end your career. Frankly, I'm stalking you for you.
Did you look past the first page of the file? No AML cells anywhere. I did the blood smears myself.
Still cancer. You know how I know? He's got an oncologist for a doctor.
And your magical leukemia detector is more powerful than a flow cytometer?
I look for zebras because other doctors rule out all the horses. In this case, you are those other doctors. You haven't earned a zebra. $100.
Are you serious?
Look, friends don't diagnose friends with cancer. I get it. Your problem is you're not objective. Your caring is clouding your diagnosis. You just cut that out, and you can be a pretty decent doctor.
So when will he be able to move his arm again?
Should be soon. Started smoking again?
No.
What does that mean? Is it bad that he's coughing?
Hi, Dad. Hey.
Alyssa, hey. I didn't know you were coming.
I was at Mom's house when Dr. Wilson called.
I can go if it's gonna be weird.
No, stay. It's fine.
Hi.
How are you?
Is he okay?
Yeah, he's okay. Not a big fan of this coughing, though.
You must be Ashley.
Hi. Hey, are you okay? Do you think this cold sore thing could have caused this?
No. Whatever's causing this is affecting more than his nerves. I need a crash cart in here! Actually, if Aspergillus fungus balls took root in his lungs and spread to his spine, it would explain both. Thanks. The treatment involves riddling the infected area with BB-sized pellets of antifungal meds.
I assume you don't just load up the 12 gauge and pepper me with birdshot.
No, we have a slightly more humane delivery system, but we do have to open you up. It is surgery, and like any operation, there are risks.
Wilson, he's got global lung damage. Means it's not fungal. It's PCP pneumonia.
Obviously something is knocking out his immune system. 3 options: HIV, acquired SCID, or my personal favorite, cancer. I'm sure you will test for all 3.
You have acute lymphoblastic leukemia, ALL.
So, it is a recurrence.
No, it's different. It's a second leukemia, probably caused by the chemotherapy we gave him 5 years ago.
That's why you didn't see it. Maybe they can rename it ironic leukemia.
This is not the end. Tests show that the cancer is limited to your brain. That's good news.
How can cancer in his head be good news?
The blood-brain barrier separates the blood in your head from the blood in your body. Keeps the cancer bottled up. We can go for a cure.
So give me the numbers. What are we looking at?
90% chance of cure.
Really? What if we're in the 10%?
Steady decline, about 6 months of a good quality life.
Does he have to go through another bone marrow transplant?
No. Chemotherapy. We can go at this with drugs alone.
When do we get started?
We begin by surgically planting a shunt so we can get the drugs directly into your brain. I already booked the OR.
You're the only one who can make cancer sound like good news.
We get it out of your head and you walk out of here. Paralysis gone and cancer-free. Move your fingers. The chemo's not working.
Does that mean it's not cancer?
No, it means the chemo from your first round of treatment has made the leukemia resistant.
So I'm in the 10% that don't get cured.
Maybe not.
We just removed a screw from the guy's lung. The weird thing is he didn't get better. Any idea what that means?
It means you're not listening to me.
No, it means I'm ignoring you to make a point. There's a difference.
The problem with that technique is I have no idea what point you're making.
That your idea is implicitly not worth responding to. Doubling your patient's chemo dose is stupid. Damn, now it's explicit.
It could swamp out the resistance of the cancer cells.
The fact that it theoretically should work doesn't make it any less stupid.
Of course it does. It's exactly what you would do.
I'm me, you're you.
And a table is a table.
And chemo is poison. And double chemo is double poison. And I can handle it when things go wrong. You can't. And things could go very, very wrong.
I can handle it.
Look.
I can move them.
Hey!
What is it, Jim?
I'm gonna need to run some tests. The cancer's gone, but over half his hepatocytes are dead.
In only 24 hours?
He needs a new liver.
Well, look on the bright side. You can publish the results of this case study. No one will ever double the dose again.
If I don't find you a new liver, you've only got about 24 hours left.
So what do we do now?
Your father's been moved to the top of the transplant list, but all we really can do is wait.
That's it? We wait? Tell me something that I can do.
I'm sorry, Mel. You and Emily don't match Tuck's blood type, and neither does Ashley. So a live liver donation is out. The best thing to do is just what you've been doing. Be together.
Hope he already told you that you're gonna die. Because it's gonna make what I'm about to say a lot more relevant.
House, I know it's raining out there in the hallway, but...
I was just in the ER, testing my patient for autonomic dysfunction. It's the only department with a shower big enough for the whole team, plus the cardiac monitors, plus me. Anyway, relevant part. Just wheeling the guy out, trauma came in. Motorcycle versus semi.
How bad?
Bad for the motorcycle, good for your liver. Blood type's a match.
Why wasn't I paged?
Because there was a problem. No organ donor card. Dead guy's sister is next to kin. She's refusing to allow the donation.
Where is she?
20 minutes away.
It's not fair, Jim. You just helped me get my family back together. I'm not ready. I would have had 6 more months with them if you hadn't given me that extra chemo. Now I have less than 1 day.
I'm sorry. We knew the risks.
I don't want to lose them again. I can't lose them again.
There's nothing more we can do.
5 years ago, when I needed a transfusion, you used your own blood. We have the same type, which means you can give me a part of your liver.
I'm your doctor.
You're my friend. Should I die because you're also my doctor?
Of course not.
Fine, then. You're fired. Now you're just my friend. Now you can do what's right.
Tucker, I can't. I want to donate a lobe of my liver to Tucker.
That's insane.
I'm donating a small portion of...
You have hundreds of patients.
And until I run out of excess organs, why shouldn't I do everything I can to help them?
Because you're a doctor, not a donor.
Why did you make me the head of oncology?
Not because you have the most organs. You're thoughtful, caring.
Yeah, caring. By your own criteria, a strength and not a weakness.
This is coming out of guilt.
This is coming out of friendship. I have a friend who's about to die, and I have the opportunity to save his life.
Okay.
My son is not huffing Freon.
Mr. Arnold, Dr. House is like a savant when it comes to diagnostics.
What's his genius theory? Because Kenny's not normal? He's doing drugs to deal with his pain?
Maybe the way to look at this is that you are normal.
And what's that supposed to mean?
You're like any other parent who thinks his kid can't be doing drugs.
Doing this because my dad thinks I'm on drugs?
I was doing drugs behind my parents' back at your age, and I had a lot less reason to be. Not that your life must be miserable. Not that I'm suggesting that you should be doing drugs. How's school going?
I'm homeschooled.
Really? You're lucky. Going to school was boring.
My dad took me out, and it wasn't because it was boring.
I had a rough time in school, too. Maybe not like you, but, I don't mean to compare our situations. Actually, I guess I am comparing our situations, but only to show you how yours is worse. You can edit that out, right? So I don't look like an idiot?
Relax. Everyone acts like an idiot around me. Makes you think it's not an act. Can I have something for my headache?
Yeah, is that new?
16 years old. It's the same birthday I do.
I'm gonna start the test now. Study showed no signs of scarring in Kenny's heart.
It wasn't drugs.
Well, then give me something better. What's causing heart block?
It could be toxoplasmosis. We should do an LP to test for infection.
It was toxoplasmosis. We'd have seen enlarged lymphs. And because you're not pretty enough to be an idiot, you must know that already, which means you just said it because you want to do an LP to look for intracranial pressure.
Because it is intracranial pressure.
Wait, I'm not done. You thought I wouldn't catch on, which means either you think I'm an idiot, which is flattering. I'm doing my hair differently.
The kid's got headaches. He's been popping his acetaminophen like peanuts.
How could you possibly think that I was done? I prefaced that with an either. It needs an or. Or you are an idiot, which is possible. I'm not great at judging men's looks.
The OR?
And the MRI room.
Yes. Dr. House frequently conducts differential diagnoses in a variety of places. He feels that a change in venue often leads to a change in thinking processes. I have to go take care of something else.
Just let me do a CT scan, see if I'm right. The sooner we fix the problem, the sooner we can get to his reconstructive surgery.
Who cares if you're dead? It's how you look. Well, since you've given me nothing better, we're back to drugs.
The one thing we know it's not.
Decreased uptake on the membranous septum.
Could be an artifact. We can redo it, but...
Nothing's nothing. Do an EP study.
EP study means we have to stop this kid's heart.
I'll set it up.
House. You have a minute to be disemboweled?
I'm going to thread this catheter through different areas in your heart, and once I found the right pathway, I'll apply some electrical energy.
It'll stop my heart?
Sounds worse than it is. It'll be fine.
Is it gonna hurt?
There'll be some discomfort. If you've done drugs, I understand. Being different's really hard. Kenny, it's more important for you to get better than to worry about getting in trouble.
If I did drugs, that could explain my heart problem?
It could.
And then you can do the surgery to fix my face?
That's why we're here.
You know how famous people, everywhere they go, people are watching them, staring? They never have a chance to just be. You know? And a lot of them turn to drugs. People stare at them because they're beautiful, but me, they just stare.
You okay? I need to know what kind of drugs, Kenny, and how much.
Coke. Mostly a lot of coke. And then when I run out, I usually go to LSD or acid.
Those are the same thing.
They are?
You don't do drugs, do you?
I drank from my dad's liquor cabinet.
We're not going to do this test.
No.
I need you to turn on your side. We need to intubate. I need some help in here.
No tumors in the patient's stomach, so...
The scope caused varicose bleeding. Took 20 minutes of banding to stop it.
Todd was right about the liver failure.
Yeah.
His craniofacial deformity is causing intracranial pressure, which is causing...
Where are the nosebleeds? Where's the labored breathing? You were right about me being wrong. You're wrong about you being right. I need new ideas. Anybody? Does it bother you that this kid's gonna die because you won't put down that camera at all, you know?
You people should be extra motivated. I'm sure they all want to look good in the film.
No, because now they're too worried about looking bad.
Dr. House, heart block plus liver failure could mean autoimmune, maybe scleroderma.
Foreman, does that make sense?
Not without tight skin on the hands, muscle weakness, and a 30-year-old patient.
Liver failure plus heart block could be a mitochondrial disorder.
See what she just said.
Liver failure plus heart block could be a mitochondrial disorder.
Go look for signs of retinal degeneration.
No, it's ICP. You're only going to see swelling.
Take him with you so he can see the degeneration too.
Lean forward and place your chin on the rest.
I can't reach it.
Scooch in a little.
I'll take care of it.
Just like last time?
Maybe we should try this the old-fashioned way, Okay, look up to the ceiling and try not to blink, okay? Okay, good. Now straight ahead. There it is. Swelling, no degeneration. It's not mitochondrial. Swelling proves there's increased pressure in his brain.
Absolutely.
So now we can schedule the reconstruction.
Absolutely not.
Your test proved you wrong. We found exactly what I predicted we'd find.
Swelling means there's increased pressure. You get a gold star of David for proving, yes, this kid has a big head and big heads cause pressure. It doesn't explain the liver.
Too much acetaminophen does.
JRA explains all of it, including the liver. One theory is better than two. Treat with steroids.
If you're wrong, steroids are going to mess with his immune system, put off his surgery for months.
You really want to lose this argument in front of the camera?
I'll speak to the father. Dr. House believes that Kenny has JRA, juvenile rheumatoid arthritis. We need to start administering steroids.
Will the steroids fix it?
I don't think he has JRA. I think Dr. House is wrong, and that the steroid treatment could be dangerous. I think I can get House thrown off the case and get Kenny the facial surgery he needs.
Didn't think you had the guts to stage a coup.
Coup failed. Scheduled for execution at dawn.
No, you're not.
No reprieve from the governor.
You're a test result away from becoming House's front runner. He doesn't care about what you said or what you did 5 minutes ago. He just wants the next good idea. Show me 20% magnification of the forebrain.
I look at our patient. As soon as I saw his face, I saw a regular kid. One thing about being a plastic surgeon, you don't see what is, see what could be.
Talk like that around House. Doesn't matter how many good ideas you come up with.
Wow, you are ugly.
Wow. You're an ass. I have a deformity.
I know. That's why you're ugly. But you're a lucky boy. Anywhere else in the animal kingdom, your parents would have eaten you at birth. Your son needs steroids. Dr. Cuddy agrees.
Does Dr. Taub?
He's not a real doctor. He's a plastic surgeon. All he cares is that your son looks good in his coffin.
So I'm supposed to believe you? A doctor who cares?
You shouldn't care if I care.
I don't trust you.
Because I don't think the surgery's important. You're putting your trust in someone who does think the surgery's important. You're willing to take chances, to risk his life for something he doesn't need.
I do need it. I can't have real relationships. I can't even have a real conversation. Not even with my dad. Dad, I know you love me. But you don't treat me normal. You're always protective. The world can always go to hell. But you never yell at me. Even when I screw up. I want to be normal.
Take your steroids, and you get to live. And you can do your surgery. And it'll only change your face. It won't change who your face made you.